Well, hello everybody. My name is Jyoti Engel, and I lead the Regulatory Knowledge Core for CRCA. It's going to be a few minutes before, it's not a real break, we're just switching slides. But I'm going to go ahead and introduce our next team of speakers. So yesterday we heard from Dr. Lyle Best and Dr. Pumala on their research projects, and today we'll hear on CRCA's third large research project. So it gives me pleasure to introduce our speakers today. The project is led by Dr. Nancy Fehrenwald, who was not able to come today due to a family emergency. And filling in for her is Shanna Harming. Shanna is a research coordinator for the College of Nursing at South Dakota State University. Ms. Harming holds a Bachelor of Science degree in Psychology, Secondary Education, and Special Education. Ms. Harming spent her formative years growing up on the Lower Brule Reservation and is a member of the Lower Brule Sioux Tribe. She has dedicated her career to working with Native families and communities to help close disparity gaps in both health and education. The next speaker of this team would be Dr. Brian C. Britt, is an assistant professor at South Dakota State University. He earned his PhD in communication as well as master's degrees in communication and statistics from Purdue University. As a computational social scientist, Dr. Britt specializes in research on large-scale online organizations, such as the emergent communities that organically develop around social media campaigns and initiatives. Dr. Rebecca Britt is an assistant professor at South Dakota State University as well. She earned her PhD from Purdue with an emphasis in health communication. Dr. Britt's research is largely interdisciplinary in nature through technology, new media, and health, and focused on serving the needs of rural communities, promoting health through interventions and education, targeting underserved populations, and examining health disparities. The presentation title is Harnessing Social Media to Extend Research for Living Kidney Donation Education. Please join me in welcoming the team of fantastic researchers.
Good morning. I am Shanna Harming, and I'm the research coordinator on this project. And Nancy wanted me to give the message that she truly regrets not being able to be here today. And so it's nothing like someone saying, "Can you jump up and present for me today?" Yes, I can do that. I have been the research coordinator on this project for a very long time, and I heard other folks say how they were able to be at the very first CRCA conference here in Sioux Falls, and I was one of those lucky ones as well. I just had joined the College of Nursing team at that point, and so I've always so enjoyed coming to all these conferences, and this is actually the second time I jumped in and presented for Nancy, so I guess I'm seeing a pattern here. But I will be giving some background on our overall project. We're going to be discussing how we're using social media to extend our research. But our overall project was to develop a culturally sensitive education for Native Americans on dialysis, about living kidney donation and transplant, as well as how to have a conversation with family and loved ones. And then when I'm done, my colleagues they're the experts on the social media, so they'll take over. Okay. So throughout this project, we've had a lot of partners. Without them, we would not have been successful in our endeavors. But first and foremost, our tribal community partners have been so important. Our community advisory board has been with us since the inception, and they have guided us, given us feedback. They worked with us hand in hand when we're developing our educational materials, and they have been priceless. We've also worked with our tribal health directors and other community members in the tribal health board, and then also our dialysis centers, where we were able to, when we tested the intervention, we worked closely with them, and then on this social media campaign, we went back and worked with them once again. Sanford Research has been very important, and Sanford Transplant Team is actually our clinical advisory board on this project. And then our project team, the nursing department, and the stats folks, And then again, with our aim for bringing in more partners in communication, marketing, and media. And then prior to launching our social media campaign, we wanted to partner with other social media outlets. And so the Great Plains Tribal Chairman's Health Board, South Dakota Urban Indian Health, tribal colleges and universities, just to name a few of our partners. A little background on our overall project. About 15 years ago, Nancy Farnwell did a different project in tribal communities trying to get folks to sign up for the organ donor registry. And during that project, she heard time and time again from the community members, we really need kidneys because of the diabetes epidemic. And so when an opportunity came for another grant, such as this one, to develop education, that really aligned with what she was hearing the communities say their needs were. And as you know, Native Americans have higher rates of diabetes, which is a leading cause of kidney failure, which then translates into higher rates of end-stage renal failure. And once someone gets to end-stage renal failure, there's really only two options for treatment, and that is dialysis or getting a kidney transplant. And so this work is very important. Prior to this, there was no tests of education for Native Americans on dialysis regarding living kidney transplants, so ours is the first. And our purpose of the overall study, that has been to develop a culturally targeted education for Native Americans on dialysis regarding living kidney donation and transplant, and also how to have a conversation with family and loved ones about this sensitive topic. Our goals and outcome, again, during the project, working with the tribal advisors and community has been really important. And we have about a year left in the project, and I cannot wait until we can give our educational materials to everyone. So of course, on completion, that will be available to our tribal communities, the health clinics, the dialysis clinics, and really anybody who wants the education. And I've heard many times through the course of this project, this education isn't just great for Native Americans, it's great for everyone. And so again, upon the completion of the program, we will be able to disseminate all of our educational materials. The specific aims, I'll just briefly go over what we've done so far in the project. But during AIM 1, we went to the dialysis centers and interviewed Native Americans on dialysis to ask them, what would you like to see in an education program? What would have been beneficial for you? What would have been beneficial for your family? What do you think your community needs? How would we deliver that education? And so those interviews really laid the foundation and let us begin this development of these educational programs in a good way. And then in AIM 2, of course, we developed the educational materials, which, when I say that, it seems so easy, but that aim took a long time, and we were delayed and delayed and delayed, but we were finally able to create a 24-minute video and accompanying brochure that reviews the risks and the benefits and the overall quality of life that people can experience after transplant. And it's important to note that the dialysis centers do a great job of educating their parents, or their patients, on living kidney donation. And this education was not meant to replace that. It is just simply supplemental. And our videos really center around the tradition of storytelling, and that was really important for our Community Advisory Board. And so during the course of the videos, a lot of our Community Advisory Board who appear in the video tell their story of how they either donated a kidney or received a kidney, what their fears were, what some of their barriers were, how they were able to overcome those barriers, and then the result of the transplant, which was an overall better quality of life. And those that storytelling is so powerful. When we were able to go and show the education, and then we did some follow-up interviews, that came up time and time again, but that was so key to inspiring hope and people who watched the educational video, and also they were very appreciative. What their comments were, it was good to see other Indians telling their story. And so we're very proud of the educational materials, and actually the educational materials, the title is called Hope and Healing Through Living Kidney Donation and Transplant, and that title also came from our Community Advisory Board, that they wanted specifically, they did not want us to focus on doom and gloom. They didn't want a lot of hospital clinic in the video. They wanted to inspire hope, and so with their help, I think we were able to capture that. And then in AIM 3, we conducted a group randomized test of the intervention in dialysis clinics, and then again examined the effect on outcomes of knowledge and also related conversation with family members. And we also did a hope index and measured hope. But the significant findings during AIM 3 were people who saw the educational program were 5 times more likely to say that they had or will talk to a family or loved one about living kidney donation. So that was really important. When we were doing the focus groups and the interviews at the start of this project, talking to the community members, they all realized that this was an important issue. They all had stories of a grandma or mom or an auntie that was on dialysis. But the question that kept coming up over and over again were, why aren't we talking about this? You know, and there really was no answer. And wherever we went, it was either in Minnesota or South Dakota, that kind of kept coming up. That this is a topic that we need to be talking about, and we're not. And so one of the great things about our educational materials, it lays that foundation and gives something to talk about as some of the people that participated in our research were then, they got the video and the brochure, and they were able to share it with their family and friends. And then when we went back and later did the follow-up interviews, they were saying that was what started the conversation. You know, they were, here's this video, I'd like you to watch it. And so having our education being able to be used as a tool to start these important conversations is great to see. And in AIM 4, again, this was inspired by our Community Advisory Board because they were so excited. They wanted to get that education out there. They wanted it online. They wanted the video available. But of course, since our research was continuing, we can't do that until the end of the research. But it did inspire us to further the reach of our education through social media, Facebook, Twitter, and Instagram. And so again, our Community Advisory Board was very key. They came up with great ideas. They were the inspiration for our social media campaign, and my colleagues will come up, and they're the experts on social media, and so they'll tell you about our social media campaign.
Thank you, Shana. All right, so AIM 4 comprises our social media campaign. Essentially what this campaign is designed to do is share many of the existing materials that were already developed as part of the campaign to a much broader audience. We particularly wanted to disseminate these messages over social media because we were thinking about how to reach potential donors. Many of the initial education objectives that we accomplished in the first 3 aims of this study were targeted more toward the potential recipients of organ donation, of kidney donation specifically, as well as their immediate families. So they were able to have conversations with their loved ones. But we wanted to broaden the reach as much as possible to reach those younger populations who might be more likely to serve as potential donors. That's the other half of the kidney donation problem. So what we ultimately did was we took those materials that we initially had, we shared those with a variety of users online, and we tracked the diffusion of those messages in order to attempt to broaden the reach of those educational materials. We then targeted the most highly influential users, the opinion leaders within that specific online context. And those highly influential users are now receiving personalized messages that they can share with their own followers. So I'll go into this in a little bit more detail here. As a first point, though, we're conducting a social media campaign because of what our Community Advisory Board wanted us to accomplish. We needed to reach that younger population, including the potential donors. The other aspect of this that's important is that we're able to make use of social media and social network science within this particular effort. If you think about how a lot of health campaigns tend to go, we might think of public service announcements, the commercials that we see on television, for example, that tell us, don't text and drive, or, oh, if you pick up a cigarette, it's like eating shards of glass, things like this. Now, these messages may stick out in our minds. They may have an effect to a degree, at least. But at the same time, this effect is limited. Because oftentimes the way that we perceive these messages is coming from an outsider, coming from someone who's not us, who's not a trusted confidant, who doesn't understand our unique circumstances. And so we readily discard it in the same way that we've become accustomed to ignoring commercials on TV, other advertisements and the like. As such, these messages don't tend to be as effective as they could be, as they would be if they were delivered by someone who we did trust, whose opinions we did take seriously, someone we personally viewed as having credibility. And so that's where social media can come in. Because when you hear from your friends that this is an important topic, when you hear from people you already respect and trust, that this is something you need to pay attention to, this is something you ought to think about doing, this is something you ought to investigate further, we take those messages much more seriously. And so what we aim to do in this project was create a dynamic social media campaign that harnessed the existing credibility that opinion leaders had within their current social community, rather than coming in as outsiders and trying to tell people what to do, what to think. We wanted to see if the opinion leaders within that community would be willing to act on our campaign's behalf, to act within the cultural context, as opposed to us coming in as that outside party. Now, as for the start of the campaign, we began with a series of interviews with people who had already participated previously in our efforts, those individuals who were on dialysis at present. So we conducted a series of evaluative interviews with 55 current dialysis patients who had previously engaged with our materials to ask them, what did you like about these materials? What stood out to you? What helped you when you engaged in conversations with your friends, with your families? What were the most poignant, salient messages that we should carry forward into our social media campaign? What should we really focus, at least initially, on trying to spread? We used then the results of those interviews to help in terms of developing new materials, as well as tailoring the materials that already existed. Think about your engagement with social media. You probably don't go on Facebook and watch a 30-minute video. That's not a realistic expectation. People use social media, they use the internet in general with different kinds of expectations. And so we needed to tailor even those existing materials to the social media context so that people would pay attention to them, so that we could deliver a powerful message in a much shorter period of time. So this involved substantial video editing. Rebecca Britt over here also created a number of additional materials, especially image and textual materials, that we could disseminate to these populations. So a substantial amount of work went into this initial development of materials to be disseminated to the community. So in terms of this qualitative study, we conducted a series of one-on-one recorded interviews. It's worth noting here that we did not conduct these interviews ourselves. As this is a very sensitive type of topic, we didn't want to invade the privacy of those who were undergoing dialysis. So instead, what we did was we asked several community partners, the heads of several dialysis centers, if they would be willing to recruit participants on our behalf, to see if people going through dialysis would be willing to share their stories with us. So we trained 3 different site coordinators, and those site coordinators conducted those interviews for us. They were audio recorded. We used the constant comparative method to analyze those. We ultimately found by and large, was that people tended to love the stories of successful transplants. They wanted to have that hope of things going well. Here's what actually worked. Here's the difference that it made in our lives. This also relates to the positive quality of life that people ultimately experience after transplant. They also wanted to have more information about the process of going through donation and transplantation. What was actually involved in order to make something that could otherwise be very mysterious, very abstract in nature, much more tangible. If you know the process that you'll need to go through, if you know the steps that you're expected to undertake if you want to help someone, well, you're much more inclined to actually do that as opposed to if it's just an enigma out there. So those campaign materials were again amended for social media. They were edited substantially for length and to focus on the most important content that we wanted to share. We also created a number of images, edited those that were currently in existence and created brand new ones, and developed focused messaging that would be shared online. And again, this effort was headed up by my colleague, Rebecca Britt. I'll give you a couple of quick examples just to show you what we ultimately looked at here. We had a couple of hashtags that we created. So we see the hashtag Hope and Healing at the top. We also have the Share Your Hope hashtag that we've used at a couple of points throughout this campaign. We have a few examples of large graphics that we used throughout the campaign as well to help represent and identify what's ultimately going on here. You see several dynamics going on. We see some of the key cultural elements being embedded within this image to make it clear who this is really for, what this is really about. We also see the community of people who were involved with this, people whose lives were touched by these efforts, just to make this more real and more personal. Now, beyond this, we've since started actually conducting this campaign with materials that have been created. So this campaign is launched on Facebook, Twitter, and Instagram. We launched the campaign on all three platforms at the start of November of last year, and it's still ongoing now. We're going to continue this campaign through July. So our message dissemination, essentially how this has worked, is that we've started off with those initial messages that have been developed, and we've begun disseminating those with the help of our tribal partners into the community. So several tribal colleges, for example, as well as other community partners, have helped us with initial points of contact within the community. What we've ultimately done is we've observed early engagement with these initial materials. I keep saying initial materials. We'll get back to that momentarily. But this initial seed of sorts that we've added to the community, we've observed how people have interacted with those, including their comments, the way they've liked and shared those with their friends, the retweets that they've had, so on and so forth. Based upon that, we've built a network of users surrounding our campaign. So this emergent community of people who have engaged in some fashion with the efforts that we've ultimately been sharing. We can kind of think of this ultimately sort of like an angiography. If you're not familiar with an angiography, essentially how that works is that there's an injection of dye or other such substance into the bloodstream, and then we can use imaging technology to assess how that dye, along with the blood, flows through a person's blood, flows through the cardiovascular system. This allows us to map out that network of blood vessels within the human body. So oftentimes what people do with that is they'll look for blockages, and they'll also see pathways where things are working properly. We did something similar here. You can think of the initial messages in this campaign as that initial injection. We then track the diffusion of those messages over time, allowing us to see how that network forms. So what we wanted to do in our case was to find those major arteries. Who were the key hubs? Who are the major sharers? Who pushed these messages along? Who helped to communicate these messages to their friends, to their colleagues, to their family members, to their followers? Who are those individuals who were interested enough in this topic to actually engage with it and were influential enough to spread those messages to a large number of people? Those were the major opinion leaders we wanted to identify. And ultimately, we did identify 4 especially important individuals who we're beginning to work with now. And this brings us to the last part of this process. Now that we've identified those highly influential social media users, we're developing tailored campaign materials as opposed to those that were initially disseminated en masse And we're also working directly with those opinion leaders. We're starting training efforts to help them to better, more persuasively speak with their friends, with their family, with their colleagues, in order to better further spread the messages of our campaign, to help have more of an impact, to serve as really influential opinion leaders in this community over time. So this effort is currently ongoing. So we're expecting, consequently, a substantial increase in engagement from the community based upon these efforts. Other similar health campaigns that have made use of opinion leaders have seen much more of an impact as a result, as opposed to those public service announcements that come from an outside source. When you have people within the community who take a vested interest themselves, who take it upon themselves to take ownership of the campaign and to spread the word about it, you ultimately have a much greater impact as a consequence. That's what we're ultimately expecting here as a result of our efforts. And so we'll begin tracking this in the months to come, all the way through the end of July of this year. Now, as for the next steps of our campaign beyond July, I'll turn this over to my colleague Rebecca, and she'll talk a little bit about that.
Hi. So as a result of our next steps, what we're going to be doing is, once we have all of our data from July, our next goal is to primarily conduct a nationwide effort. And so what that means is that once we've been able to sort of see how this process of understanding the behaviors of those opinion leaders in communities through this essentially culturally tailored effort works, we'd like to conduct a more wide-scale effort and to be able to produce an effort like this nationwide that really reaches out to communities at large across the country. That may start at a more regional level and then essentially spread to a nationwide level, but that's the ultimate goal, is to really spread these types of efforts to essentially spur these types of message strategies, to really spread education materials, awareness, spread images, videos, stories, because we found that even so far in some of our initial analyses, which we have ongoing on a weekly basis in order to help share what kinds of messages are people sort of responding to, watching, interacting with, and viewing, we're seeing that those are materials that people are really sort of engaging with and finding to be most helpful. And so we really want to see and interact with those users on a much broader level, since those are conversations that are largely otherwise not happening. And so our next goal really is to take it to the next level. So beyond a statewide effort, really kick it into a nationwide level. Of course, again, we really can't do that until we have that full data and we can really look at it comprehensively and then spread it to that nationwide effort. So that's ultimately sort of our final goal. Of course, if there are any questions, we'll be happy to address those further if you have any. As a result, that sort of concludes what we have to share with you, and we'd love to address any questions, thoughts, or concerns that you might have. So thank you so much for your time and willingness to listen to our thoughts regarding this campaign. So thank you.
My name is Delilah from the American Indian Cancer Foundation, and using social media, we do that a lot. And when you're working with communities, and you talked about your opinion leaders, how do you guys find your opinion leaders, and how do you engage in that conversation? Are they, a lot of the times in tribal communities, a lot of the opinion leaders are elders who sometimes maybe aren't like social media gurus?
It's an excellent question, and this is part of the rationale behind why we really wanted to undertake this process. You're right that traditional methods of identifying opinion leaders will use things like surveys, interview data, sometimes ethnographies, and essentially just ask people, okay, who do you look up to, who do you respect, who are the people whose opinions you listen to? So yes, in many tribal contexts, the first people who someone might point to are, well, our tribal elders, who will outright say they are the least likely individuals in the community to actually be on social media. And so there's a context disconnect there. You're certainly right. These aren't the people who would necessarily engage with a social media campaign. What we did in our study was instead start the campaign essentially like one of those mass communication type campaigns that we talked about before, almost like that public service announcement, where we just pushed out messages in mass to the community, and we watched and we saw who connected with these, who ultimately engaged with these, who shared these with their friends. So what we were trying to do in this case was assess the emergent community that was developing within the specific social media context. That way we'd be identifying not only those people who were indeed sharing materials, who were indeed respected by their peers, but who were also relevant within that specific context, so that we didn't have that context disconnect. So we've actually got a couple of articles we're working on right now talking about this notion of context-specific opinion leaders in order to deal with that exact issue you're talking about. So that's certainly a very important point that you make. Does that help to answer your... Oh, do you have a point to add? Yes, please.
One thing I'd like to add to that is, since that was a point of conversation among the entire team, is that in the initial materials from the previous aims, there were interviews with tribal elders, and so those interviews, there was at least one that I can think of that was particularly powerful that was converted to several short video clips that we included in the social media campaign materials to sort of support the idea of how elders are supporting living kidney donation and organ donation in the communities, just to inject those messages that this is something that every member in the community is supporting. And so we've got anecdotal evidence, interviews, comments, quotes, just to help continue that message that even if they're not active on social media, we still have that support in those messages. So I did want to add that in there.
Thank you so much for this important work. I was Facebooking while you were presenting with a colleague to get her permission to share some of their family journey, and I would encourage you, if you haven't already, to connect with Abigail Echohawk, who's the new director of the Urban Indian Health Institute out of Seattle. They have a very personal family story of living kidney donation that many of us followed on social media, and her brother-in-law, who's from Hawaii, donated to her brother, and it was a month process that we watched. But the kids and the family developed these beautiful T-shirts that said, "Share your spare, share aloha," and it's just a really kind of catchy phrase. Share your spare. I thought was just something that stuck with me. But also wanted to encourage you to connect with Dr. Melanie. What is her last name? Shung, out of New Zealand. They have brain donation and brain bank in the South Pacific, but really important cultural work around donation, and so you may already be aware of some of her work. But we also were just discussing connecting with the Centers for Diabetes Translation Research. NCAI is one of the key partners around donation. We hadn't really thought about it until we were sitting here, and I can't claim it. Dr. Dina mentioned it, but thank you so much. It's triggered a lot of connections for us.
Yeah, we would love to connect with you, especially about that particular story. One of the key hashtags that we actually came up with at the start of the campaign that we've been using is Share Your Hope. So when you said that, that really resonated, because that's a key theme that we've been using throughout the campaign that's resonated with community members as they participated. So I love that you mentioned that.
Way over here. So with the 3 site coordinators that you had do the interviews, I believe, my first question is, were they Native? And if they were, had they conducted research before? And if they were not Native, what kind of training, the training you referenced, what did that entail?
Great question. So during the second AIM, where we tested the educational intervention, we worked with several Native communities and their dialysis centers, as well as 2 off-reservation dialysis centers that had high population of Native American dialysis patients. And we worked with the directors of each of those dialysis clinics to ask, we presented our project, and so they were fully aware of what we were doing. They saw the video, and then they helped us select members of their staff. If they're the on-reservation dialysis clinic had Native staff, but the off-reservation did not. And so to answer your question, the dialysis clinics that were on the reservation, they were Native workers. There was a social worker. I mean, they kind of had different titles. It was just somebody who had been there a long time, was a member of the community, who had a very good relationship with the dialysis patients. And so then we selected those folks, and then for the AIM-2, we had 2 separate trainings to train them on the research protocols. They had to take the city training, of course, and they were given copies of the video and all of the materials, and then I was in constant connection with those folks throughout that whole process to answer questions, and then we did one site visit while that was going on. So then when we added the additional AIM, because this AIM-4 was not in our original proposal, and so when we added the additional AIM and we wanted to go back to do follow-up interviews, we contacted those same exact folks that did the first round of interviews, and then we did another training on these research protocols. And so, and they were all so wonderful. And even after the AIM-2, I mean, most of them said, if you have anything like this to do again, please let me know. They were wonderful. They did a great job. And so it was great. The follow-up interviews were a lot smaller. We did not, of course, utilize all of the dialysis clinics, but we were able to utilize 3. And so, yeah, those same folks in the dialysis centers conducted the second round of follow-up interviews.
I have a question over here, and my brain may be dead by now because of all the information that I've had over the last 2 days, but is this specifically research for living kidney donation for American Indians, or was I'm not clear on that.
Yes, the research was designed to develop culturally specific education. I'm sorry, I say Native Americans, but and American Indians, so there's title conflicts there, but American Indians on dialysis. So the target population was American Indians on dialysis, those folks who still may be eligible for a transplant. That was the target population for this project. And so, the AIM-4, the target population remains the same, but like Rebecca and Brian had noted, the social media campaign is more of an effort to reach possible donors, and that could really be anyone. In our video, and they're also a member of the advisory board, one of the donors was the mother-in-law. The gal who needed the kidney was Native. Her mother-in-law was not, but they ended up being a perfect match. And so, so the video, I think we showed a part of it one year at the conference, but I think there's a link to it on the CRCA website. Yeah, and so the video is like really amazing. And so again, with the social media campaign, getting out to more people, that could really be anyone, but the original target population was American Indians on dialysis. Yep.
Can I answer that? Is that okay?
Yeah.
Oh, absolutely. Yeah. One thing I want to add is that yes, because it's specifically targeted towards living kidney donation towards Native Americans is what I've been saying as well. But like with this month being National Donate Life Month, there's additional message strategies going out towards organ donation as well, just to kind of keep with that theme and to promote those messages as well, since we have had some attention from Donate Life America. There's been occasionally, they've retweeted some of our things, so we want to make sure that we give back a bit and continue to get a little bit of attention, just as any good campaign would do. So we want to make sure that we share some of those messages as well, and just keep in line with that theme, since it's that central theme of organ donation, but the core theme is living kidney donation. So I just wanted to add that notation, just given the theme of this month.
Hi, Dina Roundham from National Congress of American Indians. One of the themes that I keep hearing this morning is hope. And you mentioned that there was a hope index that you used in part of the earlier work, and I'm wondering if you can just share a little bit more about that, if it was something you created or a standardized measure, and how that seemed
Mary
to work.
Isaacson. Where I saw Mary Isaacson earlier. Oh, okay. Yeah, it's the Hearth Hope Index. Yep, that we utilize. So we did not develop. We did not actually develop any of the tools that we use. They were already researched and so. Go ahead. Right. Oh, great. Awesome. So yeah, the HOPE, and actually the I can't really speak to the findings of the HOPE. It's been a long time since we've analyzed all of that, but I do know that I was very surprised at, so they did pre and post, but the HOPE levels of all of those folks on dialysis, as some of you may know, folks on dialysis do experience depression because of their chronic health condition. But the HOPE scores were high, I thought, just relatively. And they, you know, through the interviews and different things, there was a lot of hope expressed just with their quality of life. And again, that family support was really noted in their HOPE, and just being able to live, because what they saw dialysis being is just a way to continue living. And so, I mean, just being able to live and have time with their family, just that gave them hope. And then also there was a huge spiritual component to the hope. So.